Welcome back, everybody. DangTeach at CCSD, and we'll continue our discussion on prescriptions. So this is the third part of a three-part series. So make sure you watch part 1 and part 2 before you continue on. If this is your first time with us, then welcome. And if you're returning, thank you for coming back. All right. Today it looks like we'll talk a little bit more on the prescription labeling, more in the inpatient setting than the outpatient as we did last time. And then we'll talk a little bit more on HIPAA, patient privacy. So here is a sample prescription label. So this is the one that goes on the bottle and the patient takes it with them. So we got the pharmacy, which is the provider. So the pharmacy will need its own MPI number. We got the date field. A lot of times this will be referred to as the data service. So anytime you're checking your explanation of benefits, always refer to the data service, which is the fill date. Pharmacist initial, and usually next to it, you'll have the technician's initial as well. That way we know who processed the prescription and who was the pharmacist on duty at the time. We got refills. So let's quickly recap the refills that are available. C1, 2, 3 to 5. And then we have RX only. OTC, BTC. So for C1s, you can't get a prescription. No acceptable medical use. C2, 0 refills. C3, 4, and 5, you can have 5 refills within 6 months. For prescription-only drugs, you can have up to 1 year. And PRN for the number of refills. And then, of course, OTC, BTC, no RX required. We got the prescriber information, expiration date of the drug. Most pharmacy system will usually default a 1-year expiration date from the fill date. But you better check the manufacturer bottle. Make sure that the expiration date is still within that 1 year. So reduce expiration date when repackaging. You can never extend it. And that's the whole reason. Inside the manufacturer's container, the expiration holds true. It's been tested in that container. But once we repackage for the patient to take home, then the maximum that we can put is 1 year. Drug info, name, strength, dosage form. We got the directions or the signa, patient's name, and prescription number. So we file prescription based on the prescription number. If it is a controlled substance, then the prescriptions are filed separately from non-controlled. Institutional medical order. So a prescription in retail will have the doctor's name, his DEA number, the office, all the information for the doctor. However, in the hospital, there's going to be many physicians, some resident, some coming in and out all the time. So you can't have a custom printed prescription for each physician. So they just come out with a blank order called the doctor's orders. And as soon as the patient or the doctor signs it, it becomes a legal document. So let's take a look at this doctor's order. So for pharmacy, we have to be able to pull out the drug information. So the patient was admitted to the 6th floor with pneumonia and dehydration. So here we got allergies. Pharmacy will need to enter that. Penicillin causes a rash. So we know that most likely they'll also be allergic to cephalosporin. They ordered a complete blood cell count, a Chem7, and a blood culture. So they want to see if there is actually any bacteria in the blood. Pharmacy order, NS. So we have normal saline to run at 125 mLs per hour IV. So that's going to be our first drug order. Next order, we have Tylenol 650 milligrams every 4 to 6 hours as needed for temperature over 38 degrees Celsius. So this is PRN. So only when the patient needs it will administer it. So the nurse documented that this was a verbal order. So most likely at 3 in the morning, they may have called the physician at home, asking if they can give something for fever. 6 o'clock, they're going to start their antibiotic. So here is the third drug order, clarithromycin. 500 milligrams by mouth every 12 hours. So that degree sign means hour. And then we have multivitamins every day. Ordered a chest x-ray for the morning. So maybe the ammonia, see the progression of the ammonia. So the doctor's going to put in all the orders, not just drug orders, but lab orders, diet orders, any restrictions. Medication Administration Record, or the MAR. So nurses have their shift, and at the end of their shift, they'll usually have a short meeting to see what drugs were given, what were missed, and adjust as accordingly. So for this MAR, anything that is scheduled is pre-printed. So this 1 liter bag that runs at 125 mLs per hour will last 8 hours. So that first dose is at 8. And once the bag ends, 8 hours later, the second dose is at 16. So anytime the drug is administered, the nurse administering it will initial. And then 16 plus 8 would be midnight, 2400. Multivitamins every day. So for this hospital, every day is 10 o'clock. So it's pre-printed. Clarithromycin every 12 hours. First dose at 10 plus 12 hours. Second dose at 22. And then lastly, this is a PRN med. So notice that the times are not pre-printed. You only print the date when they need it and when you administer the dose. HIPAA. Make sure you spell HIPAA appropriately. HIPAA, not HIPPA. So the Health Insurance Portability and Accountability Act. So there's two parts to it. The portable part and the accountability part. So the portability part is the continuance of health insurance coverage, and that's usually under COBRA. Quite a bit more than what you're paying into at work, but at least you have healthcare coverage during that gap period when you change jobs. It required MPI numbers, as mentioned earlier, a 10-digit unique number for anybody dealing with HIPAA information. In this case, PHI, Protected Health Information. So make sure you get the correct P term. Safeguards against exposure, disclosure, of protected health information. So you have to have passwords, lock any medical offices where your records are. Privacy notice. So patient must be given information on how their information is used and a signed acknowledgement kept for 6 years after their last service. For billing and treatment and services, then you can disclose patient protected information without their permission. So if the pharmacist needs to clarify with the doctor what the prescription is, then yeah, they can discuss that treatment just based on that. If the pharmacy needs to talk to the insurance company and that's why certain medications aren't covered, they can discuss the patient health information as long as it's for treatment, billing, and any regular service. All your personnel must be trained and documented in HIPAA, and usually it's an annual retraining as well. What does MAR stand for? Medication Administration Record. So if you're in institutional setting or long-term care, you'll always record drug administration. Which type of settings use MARS? Institution, hospital, inpatient settings. How many digits are in an MPI number? 10. Very good. HIPAA requires all of the following except. So if you choose A, you'd be correct because A is OBRA 90 requirement. So remember, OBRA required counseling and drug utilization review. HIPAA, of course, everyone must be trained. You must keep their acknowledgement. Anybody dealing with PHI needs an MPI number. Can a pharmacy disclose protected health information without the patient's consent? So we can, but remember, only the minimal necessary to provide services on the patient's behalf, communicating with the doctor, the insurance company, and or another pharmacy. All right, that's it for the prescription process. So we reached the end of the chapter. If you have any questions, just let me know when you get to class or in the comments. And again, thank you for joining us.